evening. It's Thursday, April 8, 2021 here in Cebu City. I'm Cherry Ann Lim and this is SunStar Tonight. The vaccination of senior citizens with the Sinovac vaccine will start on Monday, April 12. Chari Coronel reports.
Vaccination of senior citizens aged 60 years old and above using the Sinovac vaccine will start on Monday, April 12. In an advisory issued yesterday, the National Task Force Against COVID-19 said regional and local vaccination operation centers and implementing units should update their schedules to include the senior citizens. The Department of Health, or DOH, is expected to issue guidelines on the use of the Sinovac vaccine for senior citizens within the week. The vaccine is an inactivated vaccine against COVID-19 that was originally approved for healthy persons 18 to 59 years old. The Food and Drug Administration, or FDA, approved earlier the use of Sinovac vaccine for senior citizens, provided there is stringent evaluation of the person's health status and exposure risk. Considering the limited availability of vaccines and the growing need to protect senior citizens amid the increasing number of COVID-19 cases in the country, the FDA heeded the recommendation of the Department of Science and Technology's Vaccine Expert Panel to administer the vaccine to senior citizens aged 60 years old and above. However, the DOH and FDA emphasized the need for careful evaluation of the person's health status and exposure risk. Senior citizens are already eligible for vaccination, along with the healthcare workers and persons with comorbidities. Chari Coronel, SunStar Tonight.
The Department of Health has suspended the use of the AstraZeneca vaccine for adults below 60 years old amid reports of blood clots and low platelet counts. However, the Cebu City Health Department says this will not affect the vaccination program of the city. Kenneth Torres reports.
The Department of Health, or DOH, announced that it would suspend the use of AstraZeneca vaccine for adults below 60 years old in the wake of reports linking it to blood clots and low platelet counts, based on the recommendation of the Food and Drug Administration, or FDA. FDA Director General Rando Enrique Domingo emphasized that the suspension does not mean that the vaccine is unsafe or ineffective against COVID-19. Domingo said they took note of the recommendation of the European Medicines Agency to list blood clots as the very rare side effects of the AstraZeneca vaccine. Meanwhile, Dr. Jeffrey Ibones of the Cebu City Health Department said that the suspension of the use of AstraZeneca vaccine will not hamper the vaccination program of the city. Ibones said that the city uses Sinovac vaccine in the inoculation of the healthcare workers in the barangays and private clinics. He added some medical workers of Cebu City Medical Center were vaccinated with AstraZeneca. The city is scheduled to have its vaccination of the second dose of AstraZeneca vaccine on May. The FDA and DOH are carefully monitoring the implementation of the vaccination program to identify and appropriately manage any possible adverse events. The Philippines has received a total of 2,525,600 doses as of March, consisting of 2 million Sinovac vaccine and 525,600 doses of AstraZeneca vaccine. The country approved AstraZeneca vaccine to be administered to adults 18 years old and above. Kenneth Torres, SunStar Tonight.
After almost 3 months, the number of active COVID-19 cases in Cebu City has fallen below the 1,000 mark. Chari Coronel reports.
The active cases of COVID-19 in Cebu City has declined to less than 1,000. Based on the record of the Emergency Operations Center, the city's active cases is now at 937 as of April 7. City Councilor Joel Garganera, the EOC head, said that since April 1, the city only lagged 2-digit number of its daily cases. The lowest was 11 new active cases recorded last April 4. However, Garganera said that they are expecting that the number of cases will increase after the Holy Week. The city last lagged 1,000 active cases last January 27. The Department of Health Central Visayas recorded the highest number of active cases in the city last March 6, which was 3,565. City Mayor Edgardo Labella contributed the decline of cases to the efforts of the city and different groups in the fight against COVID-19. The public is encouraged to continue to adhere to health protocols. Chari Coronel, SunStar Tonight.
The Cebu City Transportation Office and the Sugbo Bike Lanes Board have apprehended taxi drivers who park their units along the city's bike lanes. Kenneth Torres reports.
The Sugbo Bike Lanes Board and Cebu City Transportation Office reiterated to the public that parking along the bike lanes in the city is prohibited. This after some taxi drivers were apprehended after they were caught parking their units along the bike lanes in V. Rama and B. Rodriguez Street. Under the city's policy, those who will be caught for illegal parking will be penalized. 500 pesos for the first offense, 1,000 pesos for the second offense, and 1,500 for the third and final offense. The Sugbo Bike Lanes Board also encouraged the public to report to them regarding bike lane obstructions. Kenneth Torres, SunStar Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim. Thanks for watching SunStar Tonight. See you again tomorrow. Good night.